Hi everyone, I'm Dr. Lucky Seacon, double board certified OBGYN and REI, and I am doing an Instagram live today with Dr. Kristin Lasseter. She is a board certified psychiatrist whose specialty is perinatal psychiatry, taking care of women's mental health while they're trying to conceive, when they're pregnant, and postpartum. So I'm really excited to be having this conversation with her. And earlier today, I put up a question box and hold on a second. I think she might be texting. Sorry, I don't know. I think that might have paused me. I just told her to join. So I'm really excited to be having this live with her because this is something I talk about all the time with my patients. It's something that I've talked about all the time when I'm doing Q&As. People ask about, how to best manage the struggles when it comes to mental health, feeling anxious as they're going through the process of trying to conceive and fertility treatments, and whether they can take medication safely, because sometimes that is going to be the most effective treatment on top of other options. Oh, she's out because I feel like people give really vague, non-specific information, and sometimes it feels like people are hedging, but she actually presents the data in a really clear way. Hi, how's it
Hi,
going?
good. How are
I can't
you?
believe we finally made this happen.
I know it's only been a couple of months that we've been
I
trying.
actually feel like we talked about, am I crazy to say it's been like a year? Because I feel like there's been times we've tried to connect and then it fell to the wayside. But I'm always sharing your posts because I just find everything that you put out there so useful to my patients and so useful to the people who follow me to learn more about fertility.
Oh, thank you. Yeah, I feel like your posts are super helpful too, and I love the sassiness of your
Thank
posts.
you. Okay, tell us a little bit about yourself, your practice, and where you're based so people know where to find you.
Yeah, so I'm based out of Austin, Texas, and I have a private practice where it's me and two other psychiatrists and then like seven therapists. And we
Hmm.
all specialize in perinatal mental health, but some of us also do like premenstrual disorders and perimenopausal stuff.
Really
Um,
cool. And do you
yeah,
do telemed? Do you have patients all over the country?
we have patients all over Texas. We
Okay.
haven't expanded outside of Texas yet.
Okay, cool.
Yeah.
Well, people sent in a lot of questions. I actually took some notes because there was a lot of redundant questions. I figure I might as well kind of group them into categories. Um, but I guess before I start asking you about, your expertise and to answer these questions, I'd love to just kind of understand what is what is what in terms of the patients that you see, like, do you mostly see people that are already pregnant or postpartum, or is it a mixed bag in your particular practice?
Recently, it's been interesting because I've been seeing a lot of premenstrual dysphoric disorder
Yeah.
patients or
Yeah.
PMS.
So it's a mixed
But when I was
bag.
first starting out, it was mostly like people trying to get pregnant or
Hmm.
people who were pregnant or postpartum.
Right.
Um, and now most of my partners see those people, and somehow I get all the PMDD ones.
Yeah. Well, when it comes to the trying to conceive population, sometimes it's a question of what came first, the chicken or the egg, right? Because there's such an intricate link between infertility and mental health,
Yeah.
and the mental health challenges like anxiety and depression. I've read so many different statistics, and obviously it's such a hard thing to quantify sometimes, but I've read that roughly half of patients with infertility will have some sort of mood disorder or be dealing with anxiety or depression. Would you say that's
Hmm.
accurate?
Yes. Yeah. Yeah, and it seems like you said, the chicken or the egg question, like there's a lot of research supporting that maybe it's anxiety, depression that can contribute to fertility issues, but then going through fertility issues and the stress of that obviously brings up depression and anxiety for people.
Yeah.
So it's like this terrible cycle that can happen.
Yeah, and I feel like a lot of things that can cause infertility are known to be associated with a lot of mental health issues. For instance, PCOS, we
Mhm.
know can have a mental health component. A lot of people take that for granted. And then when I tell them that, they're like, oh, I feel so validated because I do suffer from those things. And I never realized that it might be part of this larger syndrome that I've been struggling with.
Yeah. Yeah, I can't remember the statistic. I was actually just looking at another study on PCOS
Hmm.
and anxiety,
Yeah.
and I can't
Yeah.
remember, but it was a significant portion of
Yeah.
people. I think it's like 40% of people
And
with
some
PCOS.
of the mechanisms aren't what people would think. Like there's a lot of women who have obstructive sleep apnea or sleep disorder, and then that can link to things like depression as well.
Hmm.
But I want to start off with depression because that was the most common question that I got asked. And I actually shared one of your posts earlier that I always refer back to. Um, People who are, actively treating depression with SSRIs, antidepressants in general, a lot of them have this tendency to think that it's going to impact their fertility, it's going to impact their egg quality. I have to still put up the post, but I'm going to just put it out there right now and say that there's no evidence that it can impact your treatment negatively. But a lot of people will try to cold turkey it and get off of medications because they're like, I'm trying to get pregnant. So tell us what your thought process is when counseling patients about that issue. And then can you kind of in an easy to understand way break down like what your thoughts are on which antidepressants are better? And I know obviously this is such a complicated topic, but
Hmm.
just at a high level, if you could give us your thoughts.
Yeah, so in regard, and I'm sorry, my dog decided to eat his dinner right now. So if y'all hear some munching, that's what's going on. So when I have a patient who is wanting to conceive and they're deciding whether or not to stay on their medication and they're concerned about the medication contributing to difficulty getting pregnant or to
Mhm.
miscarriage, something that I think is really helpful to recognize is, like you said, we don't have any evidence that these medications impact fertility and for but we do have evidence that, stress and anxiety impact fertility and impact miscarriage. And
Mhm.
same with miscarriage with these medications. A lot of studies have been done on the serotonin SSRI medications, and we don't see that the risk of miscarriage goes above what the medications are being used for.
Mhm.
So people with depression already have an increased risk of miscarriage, and that's likely from the underlying mental illness rather than from the medication. But it kind of gets blamed on the medication because a lot of these older studies were comparing, people who were taking antidepressants to like healthy control
Right,
individuals and not looking at people with depression.
right.
Um,
How long would
so
you say we've been looking at this and studying it? Because I feel like knowing that might give people comfort that there is actually a lot more data than people would assume.
yeah, that's a good question. I don't know how old the
Like
oldest studies are.
decades, you
Yeah, oh,
think?
it's been
Yeah,
decades.
yeah.
Yeah.
Okay,
Yeah.
interesting. What would you say to someone who's on like Zoloft or Prozac? Like, what is considered the most well-studied, the thing that would bring someone the most comfort in terms of what's known and what's not known?
Yeah, I think out of all the antidepressants we have, the old SSRIs are probably the most well-studied ones. So
Mm-hmm.
Prozac or fluoxetine,
Mm-hmm.
Zoloft or sertraline,
Right.
Lexapro,
Yeah.
and escitalopram, and citalopram and Celexa. Those are the
Okay.
ones that we typically kind of feel most confident with in
Mm-hmm.
terms of saying, hey, we have like, decades of research on
Yeah.
these medications, and
Right.
and we've had so many people taking them, and we've been able to do so much research that we can pretty confidently say here are the risks of taking
Yes.
these medications.
Okay. And then I got another great question earlier today where someone said, and this might be beyond the scope of today's conversation, but just at a high level, like, how do I know I could benefit from medication?
Yeah, that's a really good question that I feel like a lot of people ask, even if it's just, we're talking
In
outside
general?
of
Yeah.
perinatal, yeah, like fertility. Like I think what some of the red flags are is if you're not feeling like yourself and you're not feeling like you can function like you normally do.
Mm-hmm.
Um, you're not able to sleep like you normally can. You're having a hard time like focusing at work or concentrating and getting things done, or you're having a lot of issues in relationships and friendships, or find yourself, kind of withdrawing from people. I think it's when things are bad enough that your life is actually changing and being affected, and those changes are staying around, right? If
Mm-hmm.
it's just, you had a hard week, obviously that's a little different, but it's, if it goes on for more than 2 weeks, then that's something to be concerned about too.
And
um,
how should people think about things like talk therapy versus using medications? Like if they're going through a hard time, infertility treatment is like a marathon, not a sprint. And it can start to wear on a person, and they might say, well, this is situational, but this is, a year in, and I don't know, there's no end in sight. I can't live like this anymore. Um, Obviously they may want to start by talking to a therapist, but at what point do you recommend medication for something like that, where someone's like, well, I was fine before the infertility, but now that I'm going through this, and if I can get through this and get to my happy ending, maybe all of these feelings will go away and everything will normalize. Like, how do you counsel someone like that?
That's really hard because it really depends on each person and kind of
Yeah,
what their history has been, and in terms of like therapy, how long have they been in it? Um, if people are having more like mild symptoms, I usually tell them to try and do therapy first,
right.
and I'll give them like a month or 2 months with trying therapy. And then if after that things aren't getting better, we have a lot of evidence suggesting that therapy plus medication
Mm-hmm.
is the best treatment. Like it's the gold standard, because both modalities are kind of going at the brain in different ways. So when you're
Mm-hmm.
doing therapy, you're using a different part of your brain versus when you're using medication, they're kind of treating different areas of the brain, and they help together to make things better. So people who actually get better faster and who have like a sustained effect, meaning they can get through
Mm-hmm.
more stressors, are people who do both.
Right, right, right. And do you get a lot of resistance to intervention from patients? I guess by the time they come see you, they want help, right? But something I find overlaps many different fields, including fertility, is that I think taking that first step can be very hard for people, because it's like admitting something, admitting that they need help. I know a lot of people personally, in my life, but also with patients, where they're kind of like, I don't want to take medication. I don't want to be on a medication for the rest of my life. I'm sure you hear that all the time.
Hmm. Yeah, and I think we still have this stigma in our culture about like
Yes.
mental health and mental illness.
Yeah.
And so even going to see a psychiatrist sounds really scary. Like, well, I don't need a psychiatrist. Like, I'm not, you know,
Right.
that bad off. But yeah, I mean, I think that what we really want is a person who's happy and healthy, and that's when we
Hmm.
see the best outcomes, with everything.
Yeah.
um, so I think
Yeah.
that would be more the
Taking a
focus.
multidisciplinary approach, it always makes sense.
Yeah.
Okay, let's switch gears and talk about anxiety. Um, Someone asked a question about having panic attacks, new in onset in early pregnancy. Um, is this something that you've seen? And, what are people's options when they're dealing with anxiety that's crippling, or they're having panic attacks and they're either trying and hoping to become pregnant, or they are already pregnant?
Yeah, I like to say that anxiety is like the stepsister of depression when it comes to pregnancy, because we have like almost no research on it,
Hmm.
which is really frustrating. So this is just going off of my own clinical experience with patients. I see that in that first trimester, a lot of people get anxious
Right.
when they've never really had anxiety before, or maybe it was like, just a little bit before, and then they
Hmm.
get in that first trimester and it kind of skyrockets. And then it seems to repeat again in the third trimester.
Hmm.
And then, of course, postpartum for a lot of people, it gets up there again.
Yeah.
Um, so For like the kind of mainstay thing again is therapy and medication, but with medications we have several different options, and SSRIs, like the ones we just talked about,
Mm-hmm.
are really good in terms of like the research that we have on them. But
Right.
for panic attacks or things that you kind of need like in the moment help
Mm-hmm.
with, if like breathing exercises don't help or kind of other therapy stuff. I really like using doxylamine for
Mm-hmm.
that, which a lot of people are taking anyways in that first trimester for nausea and sleep and all that
Wow,
stuff.
I didn't
Um,
know that you could use it for that. And it's like a rescue medication. It can break an anxiety attack.
yeah, so it's similar to, a lot of people know like hydroxyzine or
Yeah.
Vistaril. They'll use that for like panic attacks or anxiety. And so this is similar to that, but it's, a lot of people are already taking it. So then you don't have to like bring in another medication
Mm-hmm.
that the baby hasn't been exposed to yet.
Are there any well-known methods, even if it's like mindfulness exercises of some sort, to prevent panic attacks? Because I think the scary thing about panic attacks is that they're so unpredictable. And I've kind of maybe, and I'm not definitely not a psychiatrist, but I've always kind of thought of them as your body's way of saying like you can't ignore the stress. So I'm going to make you acknowledge that you're
Yeah,
stressed now.
yeah, I like that. Um, I don't know, like, in terms of research, what has been studied. I know that there's a lot of theory around like activating your vagal nerve,
Right.
and that usually
Yeah.
gets done when you're like doing deep breathing and,
Yeah.
kind of staying in the moment. So I usually ask patients to do like boxed breathing, where you kind of
Right.
breathe in for 4 counts, hold it for four
Right.
counts, breathe out for four
Right.
counts,
Right.
hold, pause, um, or like doing some sort of mindfulness
And
exercise.
then prevention wise, I guess like trying to get enough sleep, right? And managing stress ahead of time. So like exercise and
Yeah,
all of the common sense
all
things
the things
that should
that are good for
should
your
be so
body.
easy for us to do during our
Yeah,
busy lives, right?
yeah, for sure.
And what about for people with OCD? Is there something that you think is like a safe alternative or safe way of treating medication wise while trying to conceive and pregnant?
Yeah, luckily the really good medications for OCD are also the SSRIs, which
Mm-hmm.
we have a lot of research on. It's just for OCD, we often need much higher doses of those
Mm-hmm.
medications, sometimes even above what's considered like the FDA approved amount.
Interesting.
But we don't really worry about dose in pregnancy or when people are trying for pregnancy, because
Yeah,
it's more about, whether or not baby was exposed to the medication. It doesn't seem as much of a correlation with the dose. So just
interesting.
because a higher dose is used doesn't mean there's a higher risk for, baby having neonatal withdrawal syndrome or
Right.
those risks.
Okay, and then the last big category of questions that we got was about ADHD and Adderall. Like a lot of patients that I see, I've had a few that feel like if they aren't on their medications, they won't be able to function, they won't be able to keep their job, and they really do need it. But obviously, there are some safety concerns about being on medications like Adderall, amphetamines in pregnancy. So, how do you strike that balance? And are there alternatives that can be somewhat effective, maybe not as effective as Adderall, that pregnant women or those who are hoping to be pregnant can consider?
Yeah, well, Wellbutrin's one that's an alternative that people can consider that we have more research on.
Yeah.
But we don't have research suggesting that those medications are bad. It's
Mm-hmm.
just we don't have a lot of research.
Right.
And so when we don't have a lot of research on something, we don't feel as confident about being able to say, this is okay to use
Mm-hmm.
in
Mm-hmm.
pregnancy. Um, so I try and focus on like what happens if they stop the medication, and how detrimental or bad is that for them? Like if they're going to lose their job, or if they're, you know, going to get in a car accident or leave their stove on. I mean, those are pretty serious
Mm-hmm.
consequences. And that in itself can be, detrimental to a woman's
Mm-hmm.
mental health, which then has negative impacts in terms of the baby. So trying to kind of balance with like what we don't know with like the
Mm-hmm.
risks that will probably be.
Mm-hmm. Someone in the comments section just said, why don't we have the research? And I can tell you that um, there's so many reasons why. I mean, women's health issues, whether you're talking mental or physical issues, are notoriously understudied, but it's also really tough to study things in pregnant women. I mean, I've done clinical research and the institutional review board, like, forget it, trying to get anything passed where the study subjects are pregnant because there's just so much added risk and just so many other issues involved with that. But I do think it is interesting we don't have a lot of data yet considering how long ADHD has been recognized as a real problem and treated pharmacologically, and people have been getting pregnant with ADHD. So it's like surprising to me. I know we don't have randomized controlled trials obviously, but I hope we get that data because I feel like it's a question that comes up all the time. Um, but it's interesting to hear that there are other alternative medications that are being used to manage
Yeah.
it.
Yeah. And I'll also say, I think just in general, like it takes money to run research studies
Oh yeah,
and, you know,
that too.
mental health isn't, as prioritized, I think, as some of the other
Unfortunately. Yeah.
illnesses. And so we just don't get a lot of money going towards mental health
Yeah.
research.
Yeah. Okay, well, I'm glad we covered those four major types of mental health challenges and thank you so much for your expertise. I do have a couple more questions if you have like 8 more minutes, because I
Yeah.
don't want to take up too much of your time, but I figured
Yeah.
30 minutes is like the right length of time for these. Um, Something that comes up a lot is rumination and kind of like obsessive thoughts or not compulsive thoughts. What are the words where you have like
Intrusive.
intrusive
Mhm.
thoughts. Um, about future treatment failures or not getting to your end goal. Like, this is something I see in patients all the time. They're so afraid of the worst thing happening. What are some pointers? Like, what can I do to help them? What can they do to help themselves work through these really negative thoughts that just keep kind of taking over and making it even harder to cope?
Yeah. There's a specific type of therapy called CBT, which stands for cognitive behavioral
Mm-hmm.
therapy, which is so good for negative thoughts like that or intrusive thoughts because a lot of times our brain kind of gets in the habit of going down that road and then
Mm-hmm.
it just kind of keeps replaying. And so CBT really has like different skills in terms of helping you stop it. So once you even notice that that thought's coming up, like helping you redirect your thought, and then also replacing it or kind of being able to analyze like how, helpful is this thought
Mm-hmm.
or, me thinking this, is this, going to help the outcome or is this going to change anything?
Yeah.
So really kind of being able to analyze and get into what the thought
I definitely
is
think
like.
framing it in that way, like, is this going to change my management? That's what I always used to say when I was in my residency training. I got asked that question all the time as a resident, and I've really applied that to my life. Like, and it's very freeing in some ways. Like, in some ways, it can feel frightening for someone to be like, well, no matter what I think or do, I can't change the outcome. That
Mhm.
feels like a loss of control, but it is almost kind of freeing. The other side of the coin is that it frees you from the idea that the more and more you worry about something or stress about it, the better the outcome might be, because that's not true. And
Right.
so this comes up a lot. There's a lot of waiting in, what I do. People are waiting for results of their IVF cycle outcome. They're waiting for their pregnancy test results. They're waiting to see if the first pregnancy scan looks good. I always say pregnancy is a series of milestones, and I can't speak for everyone's experience, but I had a lot of anxiety in pregnancy, really, really bad anxiety. And I felt like just kind of having these ways to compartmentalize and say like, okay, I just need to get to this. Okay, now I got to this. I can breathe a sigh of relief. Now here's the next challenge.
Mm-hmm.
I feel like breaking it up into small pieces instead of feeling like you have this insurmountable mountain to climb in front of you can sometimes make it easier as well.
Yeah, that's a really good point.
Yeah. Um, what about PTSD? Do you see women who have PTSD from going through fertility treatment and pregnancy loss and things like that?
Yeah, it's definitely with pregnancy loss. And yeah, it's, I think that can be one of the harder things
Hmm.
to manage because, it's can be such a traumatic thing.
Right.
And and I think it's even harder for these patients, like once they get pregnant again, to
Oh,
have to go
100%.
through
Yeah.
that. And a
Triggering.
lot of them have very mixed feelings. And um, yeah, I mean, I think therapy is just so helpful for
Hmm.
that because it's really allowing you to sit down with somebody who has experience in helping people get through this, who can kind of
Hmm.
guide you through, what you're thinking and feeling. And I think for a lot of people, it feels very isolating and alone. And, they don't usually have somebody else who they can talk to about it.
Yeah.
So to know that, oh, okay, these thoughts I'm having or these feelings I'm having, like other people who are in the same situation have these same thoughts and feelings. Like there's nothing wrong with me. That can
Yeah.
be
And I
helpful.
think that's why people gravitate so much to online forums or even social media accounts. There's so many people going through fertility treatment that have like anonymous accounts
Mhm.
and are following accounts and cheering each other on from the sidelines, but no one, it's like this really interesting community where people feel less alone and less isolated, but they still feel protected in that, they can be vulnerable, but they don't have to put themselves out there. So
Yeah.
it is really a great tool. Speaking of being isolated, I got a couple people asking the same question. I think this is my last question for you. Um, how do you how do you advise people that are struggling with social isolation because they're in a group of friends that are all getting pregnant and kind of moving forward, and every time that happens it's very triggering because of everything that they're dealing with? It's like on one hand you tell people, stay connected because that's the best thing you can do for your mental health, but in this scenario it's so cruel, it's a cruel twist because staying connected can really trigger you and make it harder. So
Mhm.
I don't like what is your advice? I don't know what the solution is to that. I think it's one of the hardest parts about
Yeah,
infertility.
I think that's where like the support groups and community, like online community, really comes in handy.
Hmm.
There are there are like a lot of international or support groups within the United States too, where you can join virtually.
Yeah.
We have that came out a couple.
Resolve.org.
Mm,
If you can't find a support group, they can connect you with people in your area.
oh,
It's an
that's
amazing
awesome.
not for
Yeah,
profit. Yeah.
yeah, and I think it's perfectly okay to put up boundaries and to you know, maybe not cut them out completely, but just, separate yourself from friends who maybe they were a support at some point in your life, but right now that's not the support that you need, or it's,
Hmm.
be as helpful. And it's not anything against them or it's not any issue with you. It's more just your journeys aren't aligned right now,
Hmm.
and finding people who are going through a similar
It
thing.
can be really hard though to be honest and forthcoming about that. I feel like it is the best thing to do though, because then there isn't room for misunderstanding and interpersonal issues. It's like
Mhm.
just putting it out there, but I think it's easier said than done, right?
Oh, for sure.
Yeah.
Yeah. But I do feel like when people can be, clear about, look, I'm just really going through a hard time right now, and, I can't be in this text thread anymore. I need to
Yeah.
take a break. Like that,
Yeah.
that can
Yeah.
be
Give
really,
yourself grace and just be honest if you can. Okay, to wrap up, because we're at the end of the half an hour, um, do you have any parting words of advice? Like if someone is dealing with a pre-existing mental health condition, anxiety, depression, OCD, they want to start their journey trying to conceive, or maybe they're already trying to conceive, or maybe they're newly pregnant, what major resources can you point them to? I know you're in Austin, so obviously they could come see you or one of your partners in your practice if they're in Texas. But let's say they're not in Texas, they're in a different country. Like, what are some great resources that are easily available to everyone and things that you think everyone should know about?
Yeah, so there's Postpartum Support International is a nonprofit organization that is um, international, so all over the
Mm-hmm.
world. And they
Mm-hmm.
also have a provider directory,
Mm-hmm.
so you can find resources, people who are therapists or psychiatrists or OB-GYNs who are kind of trained in perinatal mental health.
Mm-hmm.
And I think that can be really helpful, especially, if you're planning pregnancy and you want to kind of get the more evidence-based
Mm-hmm.
information on what's safe versus not. Um, there's also an organization called Otis, but online it's mothertobaby.org.
Mm-hmm. I've heard of
They
them.
have fact sheets on all these different medications. So it's not just specific to psychiatric medications, but they have a ton of different psychiatric medications.
Right.
And then they also have like different psychiatric conditions like depression and anxiety and what are the risks if,
Mm-hmm.
those things aren't treated. And then womensmentalhealth.org
Mm-hmm.
is another one that they have a lot of blog
Mm-hmm.
articles that
What
can
is
be
that one called? I'm writing them down so I can put them in the caption.
womensmentalhealth.org.
Okay, cool.
Yeah.
That's really helpful. I'll definitely write those down in the caption in our joint post. One thing I really love about your account, and I've always just respected, and I've pointed so many people to it, is I just feel like your message is extremely clear, that it is so important, it is imperative to tackle mental health issues and treat them adequately and not have this self-sacrificial attitude towards pregnancy that, because there might not be all the data in the world that we need to feel something is 100% without any concern, I'm going to just forego taking this medication and suffer and just, grin and bear it, because there's actual data to show that that may actually be counteracting your efforts and
Mhm.
putting you at risk of having, heightened risk of certain pregnancy complications and even
Mhm.
impacts that could last later into childhood. And this has been well studied. And this is not to shame anyone, but it's to free you from this idea that you have to get off your medication and just deal with it on your own. And I love how clearly you communicate that. So I definitely want everyone who wants to learn more information about this to follow the reproductive psychiatrist. And because Dr. Lasseter has so much great information, she like has it very clearly posted about like all the different types of medications. So it's all very pertinent and clear for whatever you want to learn about. And I really am so glad we finally did this. And
Me
I so
too.
appreciate your time.
Yeah, I appreciate yours too. Thank you so much.
Hopefully we can do this again because there's still so many other questions we didn't have time to get
Yeah,
to.
for sure.
All right. I'll talk to you soon. Have a
All
great
right.
night.
You too.
Bye.
Bye.